Welcome to Advancing Health. Many factors come into play for raising healthy children, starting from their earliest years. Families thrive when patients are supported and connected to the right resources. Today we hear about a collaboration in Texas that is setting families, parents, and kids up for success.
Welcome to Advancing Health. I'm your host, Julia Resnick, Senior Director of Health Outcomes and Care Transformation at the American Hospital Association. Today, we're talking about what it really takes to help babies and families thrive, especially in those early years that can shape a child's health and development for a lifetime. Children's hospitals know that improving health means partnering beyond traditional clinical care, meeting families where they are and addressing medical, social, emotional, and developmental needs together. That's exactly what we'll explore today through upSTART community programs led by Texas Children's Hospital and Baylor College of Medicine. It's an innovative community-based model designed to support both children and their parents during some of the most important developmental stages. Joining me today are Nancy Correa, Director of Population Health at Texas Children's Hospital, and Beth Van Horne, Director of Research for the Division of Public Health Pediatrics at Baylor College of Medicine. We'll talk about how the program works in practice and what this model can teach the broader field about building healthier futures for children and communities. Nancy, Beth, thank you so much for joining me today.
Hi, Julia. We're thrilled to be here. Thank you for having us.
So to start, Beth, let's kick this first question off to you. I'd love to talk about the conditions that help babies and their parents thrive. What happens when those supports aren't in place, and what are the consequences for families?
So we know that babies and children thrive when their parents are set up for success. And that means that families need to be able to access and to be able to afford safe and stable housing, nutritious food, high quality childcare. They need timely access to physical, mental, and dental health care, right? And they need resources that can help them when challenges arise. Families also really need time and the capacity to build strong relationships with one another and with that child. So everyday moments like talking and singing and reading and playing and comforting, eating a meal together, these are all really incredibly important for child development. And to have this capacity, parents need to be able to take care of themselves, right? They need social support too. Someone they can call when they're running late for childcare pickup, somebody to call when they need $10 for gas, somebody to call just to kind of fill up their cup. Parents really need to feel seen. They need to feel heard and supported, and they need to feel confident, especially during pregnancy and those early years of life that can be really challenging and really exhausting. Also, really importantly, is families need to be in communities that support them. Communities where we collectively recognize that to build a strong foundation for children that is not just good for that child, but it's really good and vital for the importance of health and well-being and the future success for really all of us, right? So policies that support working families like paid parental leave and family, friendly workplaces, these play important roles in helping families thrive. And when these things are not in place, the pressures and stressors of everyday life can really quickly begin to impact the whole family. Parents may struggle to meet basic needs. They might feel isolated. They can have symptoms of depression and anxiety. We've seen people delay getting care for themselves and getting care for their kids because they don't have the capacity to do it for various reasons, right? We see this every day. When a parent doesn't know where their next meal is going to come from, they have a really hard time playing with that kid and engaging with them really well, right? They have a really hard time coming to doctor's appointments or coming to one of our program sessions. For children, that impacts their bonding, their attachment, their early brain and language development, their emotional well-being, and then ultimately, long-term health outcomes.
Yeah, so much pressure and so many different factors to think about during those early developmental stages. So Nancy, how do you see those challenges showing up for children and families at Texas Children's?
Sure. We see it coming up in a lot of ways, which has really kind of led us to kind of creating the upSTART program. And so the upSTART program has evolved over time, but it started with our upWords program. And our upWords program really began with our clinical team members being disheartened by some of the outcomes they were seeing and recognizing that if some of those kiddos that they were kind of providing care for had received services earlier, been connected to treatment earlier, had just a different earlier childhood, that child may have had a different trajectory. And so we started with our upwards program, really focused on early brain development and early language. And then from that upwards program, we really just listened to our participants, we listened to our team members, and from then just kept asking ourselves, how can we do better? How can we kind of be a better partner with the community? And just as one example, we noticed early on that our upwards group parenting class for the moms, it felt like it was being used as an informal postpartum depression support group. So what did we do? Then we started screening our moms for postpartum depression and realized, wow, a lot of these moms have, are screening positive for postpartum depression. So at that point, we recognized that we wanted to add programming into our model, into the big upSTART model that included postpartum depression support services. And that's how Uplift, another component of our upSTART program, got added.
I love that you saw a need from your community and built around that. And, you have that lovely upSTART graphic that is the circle that has the early childhood development side and the parental support side. Can you talk about how those two pieces fit together and, what that looks like in practice?
In practice, we have 9 different distinct programs. And again, this has developed over time with kind of adding new programs based on recognizing needs in the community. But in practice, all of our team members, share the same office space, talk together all the time. And it is a, constant back and forth of kind of connecting families within different programs and different team members. We are so lucky within the upSTART model to have community health workers, health educators, nurses, social workers, all partnering together to support pregnant women and families with young children. And again, since they're in a shared office space with a shared mission, it's just really great they connect all the time to figure out, again, how can we do better and how can we best support this family and kind of pregnant women.
So as you're building this model, I am sure that there is research to back up what you're doing. So what is the evidence base for building this out the way you did?
So it's been really interesting, and different programs look a little bit different. So typically when we've identified a need, we've started with what is the evidence? What are the evidence-based programs out there? And for example, the Nurse Family Partnership is one of the programs that we offer, and that has such a strong research backing and evidence around kind of supporting women and, young families. And then other times we've looked to the evidence, we've looked to the research and just haven't found quite what we needed for our communities and for our families. So quite honestly, this isn't where we expected to go, but we have learned how to do program development. And then thankfully, Beth is our director of research. And so we've done many program evaluations, randomized control trials, because sometimes when the program didn't exist to meet the needs of our community, we've developed ourselves and then had to study it to make sure it led to the outcomes that we were, expecting and hoping for.
And I think that's so common in the community health world that there are these programs that we know make an impact, but they just haven't been evaluated. So thank you for adding to the evidence base. So as other hospitals are thinking about doing this, they can refer back to you and saying, okay, if I do these sorts of interventions, this is what I expect to see.
Yes. I guess when I talked about our multidisciplinary team, I probably should have also added research assistants and research faculties and biostatisticians and data analysts that are also really supporting this work, supporting these programs.
And it sounds like, upSTART is a partnership with family and community, but it's also a partnership between Texas Children's Hospital and Baylor. So how does that partnership work?
So Baylor College of Medicine is the academic affiliate of Texas Children's Hospital. So the doctors that are in Texas Children's Hospital and our pediatric offices are typically Baylor employees. And we partner really closely together. As Nancy said, we're in the same building, we're in the same offices. And what that does is it allows us to leverage both institutions, the reputation that the institutions have and, the strengths of each institution.
So I want to dig in just a little more to the two sides of the program. So can you talk a little bit more about the infant health and development side and what those programs are that are helping build a strong foundation?
Sure. So upSTART community programs, as Nancy kind of talked about, we started with one and then we built this suite of programs because we recognize that families need different things. All families want to thrive. parents want to be really good parents, but they need different things to make that happen. And so for upwards, right, a family might hear at their pediatric office or in the community that early brain development is really important, right? And they need to be reading to their children, but maybe they don't read, right? Maybe that's not where they're strong, or they didn't grow up as English as their first language. And so they feel not very confident in that. And so they might come to our upwards program and they're in a group class with other families that are just like them. And they're learning from our health educators over 16 weeks together. With our health educators, they get a library of 16 books. They get routine developmental snapshots where they're looking at how their child is developing over time, how they're doing and communicating with that child. They get these really cool reports that show how many words their child spoke during this time. They see how many conversational turns they're taking, so they can see kind of how they're developing over time. And if there's a challenge there. And so they learn these very different, skills during these classes to support those everyday interactions like we talked about. How do you sing? How do you do a picture walk in a book? Because you don't have to read to be able to look at a book with your baby. For our UpRead program, so this is a brief program that works with pregnant women and those in that early postpartum period. And so they might be at their OB office and they are struggling to make their prenatal appointment. So they just got a new diagnosis of gestational diabetes, and they might get connected to our UpReach program, and they're going to be connected to a community health worker who's going to meet with them, kind of talk about what do they need to succeed during this pregnancy, what do they need during that period, and then early postpartum. And so they're going to help try to figure out, how do we help you get to your prenatal appointments?
I love hearing about all the tools that you're giving moms and parents to help them get through their pregnancy and help get through those really difficult early stages, and feel confident in how they're raising their kids. And this all sounds like it has to have an incredible impact. So I'm curious how you're measuring and communicating the impact of these programs.
We are researchers, right? Or at least I am, and many of our team members are kind of researchers at heart. And so evaluation plays a big part in what we do. There are limited resources for family support services in our community. And so we want to make sure that we are doing the best job with those funds as we can. We've built evaluation into every program that we have. So we do pre-surveys to figure out where parents are when they start our programs. We do post-surveys to figure out where they are at the end of our programs. We're asking for feedback throughout, so they may participate in a focus group at the end of the year to really try to figure out, okay, what are we doing really well? And where might we need a little bit more support? Where do we need to beef up our services? And sometimes that means we create a new program. And upwards, at the end of the program, they loved all the language, but they're like, hey, my child is now melting down and they have the words to use while they're melting down. How do I deal with that? Right. And so they said, oh, okay, well, let's build a new program called Upward Squared that really talks about positive parenting and how do you have control over yourself so that you can help co-regulate your child so that you guys are both regulated and can have meaningful conversations and not just breakdowns, right? And so that's how those programs get built, is by kind of seeing what our evaluation says, seeing what our parents say and going, does that exist in the community? Okay, no, okay, let's do it. And then in terms of communicating to the community, so each year we do an evaluation, like a formal evaluation where we're looking at our data. We're just finishing it up right now for 2025. And we create a data book, kind of an impact book that shares the stories, shows, where we're making improvements, our lessons learned. And then we're able to to give that to our funders. We're able to give that to the community, to our agencies so they can see, what's happening. A lot of our staff goes out. We do a tremendous amount of community events to get awareness out and to talk about our programming. We see, we hope to see around 1,500 families a year, unique families, and they cross over in different programs. So it's a lot of families that we serve. And so there's a tremendous amount of outreach that we do in the community to drive awareness. And then, as researchers, as academics, we'll publish peer-reviewed journals, we'll go to national conferences so that we can learn from other places that are doing things like this. And then also hopefully show them what's happening in Houston and what they might want to do in their community.
And just to close, Do you have any advice for other children's hospitals who are thinking about how to engage with their communities?
I think there's so many opportunities for hospitals to get involved. Beyond just providing clinical care, I see like the role of hospitals and healthcare systems. We are a trusted resource from our parents and our families, and that is not something we should take for granted. Many of my community partners that we work with cannot say the same. So really need to take that responsibility that parents come to us for advice. They want our advice. We are a trusted resource. So we have an opportunity to educate. We also have an opportunity to connect families with different programs and different resources. And then again, we have the opportunity to build these programs and offer these programs, particularly for nonprofit hospitals. We are all required by the IRS to complete a community health needs assessment every 3 years and then implement a strategy that aligns with the identified community health needs. And for Texas Children's Hospital, the upSTART community programs aligns with every single community health need that was identified in our assessment: mental and behavioral health, social drivers of health, access to care, and then maternal and child health. So again, it absolutely aligns with the work that we want to be doing and should be doing to serve the community.
Absolutely. And Beth, any closing thoughts?
I would just say, do it. Dive into your community and talk to people, figure out what they need, and then, connect with us or other hospitals, other places that provide these services to learn how we've done it and what our lessons learned are. I think if we care about child development, we have to care about what their parents are facing every day, right? We cannot ignore the fact that they can't afford gas to get to their appointments. We cannot ignore that they don't have food at home. And so we really need to think outside of the clinic walls to be able to support families. We want to be accessible, approachable. We don't want to be scary, right? People can be very scared of the medical community and technical language. They don't know what that means to them. And so having language across all of our communications to support families is really important to us. In fact, we're starting a parent advisory council to review all of the materials that go out so that we can really be sure that we're aligning the language with what will resonate with families to get them into our programs and to ensure that we're actually, meeting them where they are. I would also say that we really have to support our staff. They are the ones that make these impacts happen every day. And it can be very hard for them to see things that they can't change. So we want to be able to hear them just as well as we're hearing our families. We want to support them just as well as we're supporting our families because they're the ones on the front lines doing the work.
Well, thank you both so much for the work you do every day to support families and kids in Houston. This upSTART program is incredible, and it's a privilege to learn from the two of you. So thank you both for your expertise, for sharing with us, and for everything you do for your communities.
Thanks for listening to Advancing Health. Please subscribe and rate us 5 stars on Apple Podcasts, Spotify, or wherever you get your podcasts.